Here's a finding that surprised a lot of intermittent fasting advocates. In the study we're examining, time-restricted eating didn't improve glucose control when calories were matched. For all the claims about intermittent fasting being a diabetes solution, the blood sugar benefits disappeared when researchers controlled for total calorie intake. This demands a deeper look at what actually drives blood sugar regulation. Glucose control is fantastically complex. Yes, when you eat matters, but it might matter less than what you eat, how you eat it, and a dozen other factors that have nothing to do with fasting windows. Your blood sugar response to a meal depends on the glycemic index of the foods, the fiber content, the presence of fat and protein that slow absorption, even the order in which you eat different foods. There's fascinating research on food sequencing. Eating vegetables before carbohydrates produces a lower glucose spike than eating the same foods in reverse order. The fiber and volume in vegetables physically slow gastric emptying and blunt the glucose absorption from subsequent carbohydrate intake. This is a simple intervention that requires no fasting, no calorie restriction, just rearranging the order of foods on your plate. Exercise timing matters enormously for glucose control. A 15-minute walk after meals can reduce post-meal glucose spikes by 20 to 30%. Strength training improves insulin sensitivity for days after each session. Physical activity is probably more important for glucose regulation than meal timing. Yet, we obsess over fasting windows while ignoring the simple intervention of post-meal movement. Sleep quality profoundly affects glucose metabolism. One night of poor sleep can temporarily induce insulin resistance. Chronic sleep deprivation is a major risk factor for type 2 diabetes. If you're doing intermittent fasting but sleeping 5 hours a night, you're optimizing the wrong variable. Your glucose control would probably improve more from prioritizing 7 to 8 hours of quality sleep than from restricting your eating window. Stress and cortisol elevation raise blood glucose independent of diet. Chronic psychological stress impairs glucose metabolism. Mindfulness practices, stress reduction techniques, and improved mental health might do more for your blood sugar than fasting schedules. We tend to ignore these factors because they're harder to quantify and study than dietary interventions. The type of carbohydrates matters more than the timing. Whole grains, legumes, and intact starches produce much smaller glucose excursions than refined carbohydrates and added sugars. Someone eating whole food carbohydrates across multiple meals might have better glucose control than someone eating refined carbohydrates within a restricted window. Quality trumps timing. Continuous glucose monitors have revealed huge individual variation in glycemic responses. Some people spike dramatically to rice, but not to potatoes. Others show the opposite pattern. There are people who can eat fruit without significant glucose elevation and others who see major spikes. This personalization undermines simplistic dietary prescriptions. Your optimal glucose control strategy might be completely different from someone else's. For people with existing insulin resistance or diabetes, the magnitude of weight loss matters more than the method of achieving it. Losing 15 to 20 pounds through any method, whether intermittent fasting, calorie counting, low-carb dieting, or increased physical activity, typically produces substantial improvements in glucose control. The weight loss is the mechanism, not the specific dietary approach. Combining multiple strategies is probably optimal. Yes, meal timing might contribute, particularly avoiding late-night eating when insulin sensitivity is lowest. But pair that with food quality improvements, regular physical activity, adequate sleep, stress management, and appropriate medication when needed. Blood sugar control requires a comprehensive approach, not a single dietary trick.